Welcome to another episode of Nurse.org. Today I'll be the host, Everett Moss. Most of you may have heard my story from previous podcast episodes. I'm currently a CRNA practicing in South Carolina with a background in emergency medicine, EMS, and of course ICU. Today I have two friends of mine that'll be on with us. And instead of me giving you their background, I'm going to roll it out to them and let them introduce themselves. Mike, we'll start with you.
All right. My name is Mike. I'm a nurse practitioner for about 13 years now. I started off as a hospitalist, internal medicine, and then I kind of branched out. Now I work at anesthesia. So I do preoperative clearance here in Atlanta, Georgia.
All right, Geremy.
All right, what's up, you guys? My name is Geremy. I am a nurse practitioner going on probably 1 year now. So we're coming up on my year. I work in emergent psychiatry here within the metro Atlanta area.
All right, and today's episode is specifically about a few different categories, I would say. The title being Brothers in Practice, and specifically, Black men, men in nursing as a whole, and particularly advanced practice nursing. And we also all share common environments that we work in, common encounters that we work in, and then also I know I'm the newest one to join the whole fraternal environment, but we all also rep each other's own fraternity, and I'm sure that the guys can mention anything they like to mention about it during the process. But we'll go ahead and jump right in as far as what led us to the point that we are in our career. What are some things that inspired us? Is it something that we always saw ourselves doing? And then any pivotal points along the journey that really helped prepare us to get to where we are. Mike, I started with you on the introduction, so we'll jump right in. And what got you here today?
So what got me here? I started off as a bedside nurse in the CVICU. I'm doing trauma and open heart surgery. And how I led to becoming a nurse practitioner is that I always wanted to know the why and the how of the disease process. So I used to see people come in with the white coats and start making decisions. And me being inquisitive, I just wanted to know why these decisions were being made instead of just carrying out orders. So I decided to challenge myself and went back to school and got my master's and my doctorate in nurse practice. So
Good deal. Is being well based off what you said, you saw the opportunity for advancement, but wasn't necessarily something that you always aspired to do. Would that be correct?
no, not at all. Initially, I think nursing school gave me a run for my money, so I thought I was done. But then, as I got comfortable in about 4 years after getting my bachelor's in nursing, I was like, "Hey, I think I can challenge myself," and I wanted to know more. I was one of those nurses that when the provider went in the room, I went in the room to learn about the disease process and what the plan of care was, and I saw myself able to do that. But initially, I was comfortable at the bedside, but then when I think I excelled in my craft, I was like, might as well just go back to school and become that person that made those decisions. So,
Awesome. All right, G, what about you, man? What led you to this point in your career?
Man, it's a long story, I feel like. But
Well, we
you
only we
know,
only got
I
45 minutes, brother. Only got 45
I got
minutes.
you. Yeah, no, I'm gonna cut the hour long story down to about 5, 6 minutes here. But yeah, so much like you guys, I started out in the ICU. I was in surgical trauma ICU. I did that for about 3.5 years, and then took on some travel nursing. I did some travel nursing up in New York City, which I really kind of settled in with, doing kind of float ICU type of things. Um, my daughter was born up there, so I was like, I gotta get out of New York. So I ended up coming back down south, and then got into oncology nursing within the critical care setting, which was really cool. But it got to the point to where, much like Mike was saying, you kind of get tired of doing orders, and you kind of want to be on the other side of that, and just to see exactly what that looks like. Because a lot of times you just hear things like, oh yeah, being a provider is amazing, or being a provider sucks. So I'm like, oh, you know what? I want to look into this for myself. But at that point, I wasn't quite ready for it. But I knew I wanted to get out of bedside nursing. So I actually went back for my clinical nurse leadership degree. So I got my first master's within nursing leadership with the focus on CNL, which is a clinical nurse leader. So I did that for about 5 years, actually. Within the ICU setting, which was amazing. But then the pandemic hit, and then the toll that that took on everybody from a physical and mental standpoint. Me personally, from a mental standpoint, also having a lot of challenges going on mentally myself. I had lost one of my good relatives to a suicide, which was very, it was different. That was a different type of loss for me. And so that, coupled with all of the trials and tribulations of the pandemic, it just led me to really prioritize my own mental health and the impact that, being mentally well had on your actual physical being as well. And so, going through the motions of being in the ICU during the pandemic, it made me feel like, you know what, I think I'm doing myself a disservice here. I feel like I can be more impactful because I'm very in tune with my own mental health now. How can I continue this road and kind of pave that way for others to kind of prioritize their mental health, especially like healthcare workers, and then also, as we will get into further in the conversation, um, minorities, specifically Black men who don't normally prioritize their mental health. So that made me really kind of challenge myself, and it pushed me to want to go back to school for psychiatry. So that's actually what I did. So no, I never worked psych before. I never thought I would be a psych provider at all. But here we are, man. So we're in it.
Yeah, good deal, man. Yeah, and I those of you who will follow the podcast know I started my career in EMS and then kind of transitioned into emergency nursing, did some flight nursing, and then kind of stumbled upon anesthesia because I'd say, like most people who grew up in my environment and neighborhood, I didn't know much about healthcare. I had no doctors, I
Right.
had no, you know, uh, physician assistants. I had no CRNAs. I had none of that in my family that I knew of or had access to. So it just wasn't something that I saw myself doing as I entered into the profession. But like you all said, once you got into the profession and you start seeing these people doing more and being more, and you like, man, wait a minute, I want to do that. I think I can do that.
Hmm.
And I think that's a turning point for us all is just sheer exposure of seeing something. The saying out there that you can't be what you can't see, and some people are like, they act like they don't understand it. It's not saying that you can't be, it's just you don't know to be. If you never
Right.
saw it,
Yeah.
never heard of it, you just don't know to be. um is there anything in your background that you think really helped prepare you for where you are today? And I'd like to approach this from a non-clinical setting, even though I think we kind of plan for a clinical. But is there anything that you grew up in your upbringing, in your life, and your exposure that you think makes you well suited for the position that you currently hold?
I would say definitely. I mean, I know not jumping back on the clinical side, but my trials and tribulations of even getting into nursing school, a lot of that was very hectic and chaotic, to say the least, right? So it took a level of perseverance for me to kind of just create that mindset of keep chugging along, man, because you know your timeline is never your timeline, right? There's always something that happens that's going to interfere, whether that be a day off or a year off or a couple of years off, right? So I think going through troubled times in that regard. Honestly, since we're talking about the D9, I would say going through, I guess joining a fraternity kind of gave me a lot of perseverance options. It gave me a lot of things that I kind of went through and kind of discovered for my own self. And like, man, hey, if I can get through this, I can get through anything, right? And so it really just kind of really just opened the door for me to accept, I guess, trials and tribulations because, with this particular subject matter in terms of even working in emergent psych, it's every day is different. And, being around chaotic environments and things of that nature is almost kind of become second nature for me, and just kind of expecting the unexpected I guess you can say, it has really kind of helped me just kind of sustain a steady level of growing and optimism as I kind of go through my first year as a provider. So I would say those things kind of help prepare me for my current area.
Yeah, I would say for me is I'm Haitian, so if you grew up in a Haitian household, if you're not in a medical field or a lawyer, then you're a failure essentially. So me, when I was in high school, I pretty much, when I was in middle school, I would say, I took advanced classes. So I had to take high school classes. So when I got to high school, I already had some credits and my parents would not let me come home and hang out. So they were like, you go to school, you're going to stay in school until 2:30. So there was this program called HOSA, I think it's Health Occupation Students of America. I always like science. So I pretty much was done with school by like 11:30, 11:45 in the morning. And my parents was not going to let me come home. So this program, they took you out to different nursing homes, different hospitals, and you were able to see those kind of things. So that's how I was kind of exposed to the field. So while I was in high school, I was able to get my CNA just by joining this club. But I never used it, but I had it because I couldn't go home after school. So that kind of helped me facilitate the I would say the love for healthcare. So
Yeah, and I don't think I would add to, as far as my background goes, my father, he was always a hard worker. You know, my grandfather and I was exposed to hardworking men in my family. And then my mother, you know, she was very administrative and clerical. So it gave me a good balance of being able to get out there and work with my hands, but also knowing how to move and operate in the administrative setting. Because I mean, y'all know, being in healthcare, yeah, you clinical, but there's always that administrative side of it, that administrative flair to it that you got to know how to navigate, and then interacting with the C-suite, you know what I mean, and the people who are in those type leadership roles. I think having that exposure through my mom and pops is what really kind of helped me out in those regards. All right, so let's move on. What is it like being a black male in your particular specialty? And I'd say not even just specialty, just is there anything that you want to speak on in your entire nursing pathway? You know, like, have you noticed the difference? Do you still notice differences and some of the things that you've encountered?
So I would say for me is it all depends on what area and demographic you work at. I pretty much started my career in Tallahassee, was very conservative, very white, versus my experience here in Atlanta, Georgia is completely different. I would say being a black male in a female dominated kind of career pathway, um, I kind of reap the perks of it. They always catered to me, so I never had the home lunches. Everything. I kind of was baby essentially. So that was the plus size, especially the nurses that everyone was afraid of. The older nurses, they kind of drew to me and pretty much took me under their wings because I had one nurse. She used to wear a skirt and one of the white hats to work, and that was my preceptor. She did not play at all. So for me, I had a welcoming environment. I haven't met I would say much pushback as being a black male, but they also use you as a male. They always use you as a muscle as well too. So if anytime they needed something, they call on the male nurses as well. So my perspective and outlook on it was very productive and positive, and especially coming here to Atlanta, Georgia, where it's chocolate city. You see a lot of people like you, essentially, that are doing well and in leadership is kind of welcoming and reassuring as well. So it kind of feel like a safe space, I would say. So.
Got you. What about you, G?
Yeah, man, I definitely agree with that, especially from the just being a male in female dominant type of career choice such as nursing, which is so crazy because honestly, when you think about it, there are way more males in the field now, like than there were. We're talking about even like 10 years ago. So, and that's just across the spectrum, right? And I would say even more black males within the career field as well. So, yeah. But I think from stance of looking at my current role, since we're kind of speaking from the provider standpoint, um, especially breaking down those barriers that are associated with mental health within the black space, within the African American space, especially coming from a black male point of view, because a lot of times most of the times we weren't taught how to even channel into our own mental health. We were just taught to be strong and taught to move forward and, you know, toughen up. And, if you do anything or don't cry, make sure you do not cry. But if you go cry, I better not see it, or, don't cry at all, or toughen up and doing all the things. So I think from the perspective of me being a black male coming into that space when someone is having an emergency within a psychiatric kind of aspect, or in any kind of psychiatric crisis, right? It's almost a sense of kind of like like, oh my God, I can't believe my psychiatry provider looks like me, or somebody who can relate to, because that's the thing with psych patients. If you don't develop that rapport off top, it's hard to kind of break those barriers to get in, to kind of actually, develop a working relationship with them. So, representation matters, man. It really does. And I think, especially in a sensitive field such as psychiatry. So being able to be that voice of reason for someone in a need, when they're going through an emergency, such as like a psychiatric crisis, and just being able to talk to them like their brother or their nephew or their uncle or their son or their father, for that matter. I think that has been tremendous, and I feel I've been very impactful, working in the metro Atlanta area. Just like bro said, it is Chocolate City, so you run across the majority of people who are coming in the spaces, look like you. So it's good to be a representative for them during that time.
Yeah, I again, we've all worked in the Metro Atlanta area, and I think when you work in Metro Atlanta area, you kind of get a false sense of the healthcare space as a whole in terms of ratios, right? Because I mean, and I'm gonna say it a third time, ATL is truly Chocolate City, man. Like, it is a lot of uh, African Americans working in the space. So sometimes, you may not experience those biases. You may not experience having to prove yourself. But in the terms of male versus female, I guess it just kind of depends upon one, how you carry yourself in the environment. Because I share, like Mike said, usually I was called, to be the muscle, or they take you in, take care of you, feed you, you know what I mean, help you with the certain things, because my thing was Foley's when I was in the ICU. I did not want to put in no kind of Foley's for nobody. so I would offer to help Q2 hour turns if you could put in this Foley for me. You know what I mean? So just navigating that space. Now also, I think because of how I guess present or project, I've heard stories out there of folks walking in the room as an advanced provider, and people making the assumption that maybe they work in EVS, or maybe they're with food services and things like that. I can't personally say that that has ever happened to me, and again, I don't know the whys. I mean, I can make my assumptions. You know what I mean? 6'3", muscular black dude walk in the room. Usually I don't get assumed to be EVS. You know what I'm saying? But I have gotten transporter once. You know what I mean? But I mean, the argument could be, is that because of size, or is that because of complexion? Who knows? But I also think that sometimes um, you gotta read the room, read the situation, and sometimes it's just an oversight. Sometimes it's intentional. Have you all ever experienced anything like that in your time that you really felt was sort of or fell more into the category of a judgment as opposed to just a error?
I would say both. I experienced both. For example, now I pretty much wear scrubs and surgical cap. So to work, when I'm rounding on a hospitalist, I'm usually white coat, shirt, tie. Especially on my first 4 days of work out of 7. First 4 days, you kind of feel refreshed. You're good to go. After that, you just kind of trickle down when the week goes by. By Friday, day 7, you're just a wrap. But I would say I came in, white coat, shirt, tie, stethoscope around the neck, and the lady told me I got her food order wrong. And I'm like, clearly, I do not look like dietary, And then that was in Tallahassee, Florida. Like I said, it was very conservative, very white. I also had an experience where I had a patient. I was called down to admit the patient in the ER. Went to go see the patient. Say, hey, I'm taking over. I'm admitting you from the ER, and here's your game plan for what's going to happen next. And she asked me, she was like, who are you? And I told her I'm the nurse practitioner with the hospitalist group. And then the next question she asked me, she said, did you pass boards? And so I was taken back at first, and you always got to be professional because they are pushing about the press ganey surveys. So you really can't say what you want to say. And then my response was, in the state of Florida, you cannot practice without a license. And then I went and I just carried on the conversation. So I think she got the point at that time. But it's just, how can you just, that was the kind of question that she asked me. So like, how many, did I pass board and how many times I took it? And I didn't engage in that conversation. So I just kept on going. So.
Yeah, and I say shout out to you, Mike, on maintaining the professionalism in that type of setting. I mean, I can't think of a better professional answer that also had a little flair to it. You know what I mean? In the state of Florida, you can't practice without passing boards. So you
I wouldn't even be in front of you right now.
exactly. Right. And I like I said, I like that answer. I like that response because you know, arguably there's so many different terms out here. You got and the two things that I like lately is emotional intelligence and emotional maturity, right? Because to me, the intelligence is to be able to comprehend what happened. The maturity comes in with being able to respond in an emotionally intelligent type of way. You know what I mean? And again, that could be one and the same, but I think a lot of times, sometimes people can't process and respond in emotionally intelligent ways. And I think that was a great way to handle it. What about you, G?
I think more so like with my history as a bedside nurse, I got that. And that was like mainly when I had like long locks and stuff like that. So, you're kind of fitting the bill of the typical, I guess, black guy on the street, I guess you could say. And this was when I was like coming fresh out of nursing school, and I was working in Macon, which was like, actually a predominantly black area. But, a lot of the patients that I did serve were of other, creeds and cultures. So yeah, I've gotten those things. But again, I never really let it bother me because I kind of knew who I was. I absolutely knew who I was, and I knew what it took for me to be in this space, and I knew the hard work that I did to get there. So now, especially working in psych, it's like a lot of the things in the conversations that I have with patients, I cannot take offense to, right? Because these people are sick. So I've been called a whole lot of things, and I've and I've just, again, having that level of emotional intelligence and maturity to know, all right, this is, even if sometimes there might be a little bit of realization in that psychosis. You know what I'm saying? There might be some underlying racism in that psychosis as well, mixed in. But, at the end of the day, man, you got to know who you are, and I think when, as Mike said, coming at it from that perspective of just giving that strong, mature answer, hey, I'm here for a reason, and I'm still going to treat you how I need to treat you because I did a professional, I made a professional promise to myself and to y'all. So I'm here to do my job despite what you may be feeling or how you may be feeling right now. I'm not in this bed. I don't have to lay in this bed tonight. So
I think great info across the board is always remembering who you are. I mean, that's one thing nobody can take from you is who you are. I mean, you can allow them to affect how you feel about who you are, but they can't take who you are. They can't take the boards that you pass. They can't take the hard work that you put in. So, don't give away that power. I mean, I think that's one huge thing when it comes to maintaining who you are and what you represent is not ever giving anybody the power to take it from you, and standing down on it. So let's move on to another section. Are there any proud moments in your career, be it proud because of who you are, your heritage, what you represent, Any of those things that you can mention, it could be the simplest thing or the largest thing.
I would say I'm proud of being black. I'm just, it's lit. I went to HBCU. I think that is the first thing that they instilled in us is be proud of who you are and where you came from. And if you came from struggle, use that to push you forward. But I would say one of the things that was full circle for me was I was rounding at the hospital and I just had a family member, like a patient there. And then I was taking care of the patient. Day number two came by, and it was one of my college professors' family member. And I saw them, I had them in undergrad, and they asked me to be, I guess, from the family raving, saying that, hey, Mike sat down in the room, he listened to me, he addressed my pain, and they asked me to be the commencement speaker at FAMU Nursing School graduation. So me being barely making it through nursing school, did not want to ever go back on that campus to going back and getting my master's. And then after I got my doctorate, they invited me to be the commencement speaker. I think that was like a full circle moment for me because when I was looking into the audience, I saw myself looking up at these people and I'm like, they must be smart. They're like very intelligent, like they got it going on. And to come to find out a couple years down the line, I'm that person presenting that information to them to step out into the real world. So I would say that was like my full aha moment. So that I'm, grateful to have.
Good deal, man. What about you, G?
I think, man, really just operating in the space that I'm doing now, man, just talking to people on a day-to-day basis. When you can finally talk somebody into maybe I should take my psych meds, you know what I mean? Or maybe I should go to therapy, or maybe I should think about it this way. I've had a lot of people talk to me and tell me that they've tried therapy 1,000 times and it just hasn't worked for them, or they've tried this medication and this medication and that medication and it makes them feel a certain way, or I'm not taking this med because it made me gain weight or it made me feel like this. So just being able to actually collaborate with the patients on, again, psych is so sensitive, man. It's one of those subjects that, there's really no vital sign to kind of measure it, right? It's just how you're feeling on a day-to-day basis. And that can look so different from moment to moment to moment. And so just being able to kind of hear people out, man. I mean, 95% of my job is literally just sitting there listening to people. And just, as easy as that sound, it can be very hard because you have to literally give them the space and opportunity to open up and talk to you about this stuff, man, because it's usually not good, right? I mean, you're going to hear the worst of the worst of the worst. So, I just take pride in the knowing that I can be that resource. And it's been a great journey for me so far. So I never would have thought again that I would have been serving in this space, but I do feel very privileged. So, yeah, I would say that.
Yeah, man, I don't think I have a moment in particular. I think, had got called back like Mike was to speak at, the graduating program, that's definitely one, man, because like you said, it's a full circle moment. But I say I'm almost proud of, every step along the way. I mean, those who know my journey, man, it's been a long one, so far. I mean, which we've all had long journeys. I just think that, I've had multiple steps along the way, right? And when I go back and talk to fire recruits about, where I've been since I left or since I started the fire service, man, that's always a real surreal moment, man, because, I never looked at it as being something great. I just look at it as this is just what I'm doing. I'm trying to get somewhere. But when I hear the way it's viewed by those who saw it happening, it's like a surreal moment. Like, man, I guess I guess I did do something. You know what I mean? So yeah, that's what I would say. And then I'll kick off this other one. Have you had a patient interaction that really stuck with you? So about a year ago, I was in San Antonio, Texas, and we had a lady that had to undergo an emergency C-section, and she was really fearful, concerned about her baby. At the time, I think she was also concerned she had other small ones at home, And because this was an emergency circumstance, she was concerned about waking up and getting back to her kids. And it's what we do every day. So like, I didn't think it to be anything more special in the moment because it's what I do. And so like, I came back a month later, man, and I'm walking to the cafeteria, and this lady comes up to me and she's like, "Hey, do you work in anesthesia?" And I'm like, "Yeah." You know what I mean? Because you never know what the next comment is gonna be.
Why you
Yeah,
asking me
why you
that?
asking? And so she says, "Well, I noticed your, Spider-Man scrub cat, and I just wanted to say thank you for getting me back home to my baby." Man, that lady almost had me crying in the in the lobby, right? Because I didn't think about it, man, but what we did really touched her in that moment. And I don't feel like I ever put on anything extra. I'm just doing what I do for patients, man. But that was a real interaction that really stuck with me, man. And it's just a reminder that, what we do every day is important, and it means a lot more than sometimes what we give it credit for. What about y'all?
I say I had a patient, but I didn't have a really great outcome. But I had a patient that I was rounding in on the ICU, came in for hypertensive crisis, and they had a AAA. It was not operable. So I was in the room, and I came in to round on that patient, and a family member called the room. And the patient told me, "Hey, can you, since you're closest to the phone, grab the phone?" And I told him, "Hey, I'm here to see your loved one. Can you call him back in 5 minutes or so?" So while I was rounding on the patient, talking to the patient, he ruptured. So if I, in my mind, I was like, I could have just said, "Hey, I'll come back and you talk to that family." But in my mind, I had a list of patients to see in the ICU. I was like, "Hey, just call them back." However, because I had such great interaction with that patient over the past couple of weeks, the family member understood that, I was there to take care of the patient, make sure I was able to do the right things for that patient. So they were understanding. But in my mind, to this day, I was like, I should have let them talk on the phone. But you never know, because you see these patients, you do them every day, you just talk to them, you wave, you look at their chart. But in my mind, I was like, that was the last time they could have talked to that family member. So that kind of stuck in my head a little bit. So
Yeah, I think one I had probably like, well, I first saw this patient almost closer to a month ago, and young guy came in for a unintentional fentanyl overdose. And so, with any kind of intentional or unintentional overdose, psych always has to see the patient to determine whether it was true intent or not. And so when I saw the patient, guy looked completely just like he could be my cousin or something. Like, we talked alike, we talked about sports, we talked about all type of stuff that, a 30 something year old would talk to his homeboy about, basically, right? And so we chatted a little bit about the drug use. I told him, obviously, you know, we determined that it obviously was unintentional, and he just bit off a little bit more than what he could chew, I guess you could say. He was trying his best to kind of stop, but as with any addiction, that's easier said than done. You cannot just stop anything cold turkey. The outcomes of that is going to be very, very minimal. And my dog is trying to peek his head in, so that's what that is. Yeah. So long story short, I end up discharging him with some resources and things like that for sobriety and counseling and all of the things. And then 2.5 weeks later, I get a consult, and it's the same patient, and I'm like, why is he back? And so I dig through the chart, and I noticed that it was another unintentional overdose, except this time his girlfriend, who also came in unintentional overdose the first time, she actually died from the unintentional overdose. And so this conversation that I had with him was obviously different, right? Because when I first got on the call with him, he was very tearful, emotional, upset, felt like he, did something to me, because we just had this conversation 2 weeks ago, like, hey, let's try to work on, getting over this or getting through this, right? And then so, long story short, I ended up having to put him on a 2013, which mandated him to, immediate psychiatric treatment after he was medically stabilized. But We had a long, very emotional talk. He kind of gave me the whole, ins and outs of what happened and how it happened and the details of what happened. And it felt like, although it had a bad outcome from that standpoint, it felt like it was a turning point in his life. And he was grateful to be assigned to 2013, which is something that you really don't see. Like, people do not want to be assigned to be, mandated to an inpatient psychiatric unit. But he knew that this was basically something that needed to be done. And, he was kind of grateful and, full of gratitude as a result of that. So, sad situation again, but I think a situation that definitely stuck with me.
All right. So, next category, what, or should I say, who has supported and or mentored you, and what are some ways that you celebrate your successes?
Okay. Man, definitely family, wifey definitely held it down for sure, for sure. Along the roads in terms of me going back to school and clinicals and, hey, you got to watch the kids all day while I work for free. Like all of those things, just the simple stuff, man. You know, making sure I have something to eat when I come home, make sure the house is kind of clean when I'm not. And I'm usually the cleaner, but, I don't mean to call her out, but I'm usually the cleaner. She did a thing when I was in clinicals and stuff, But yeah, so family, friends, you, bro, definitely helped me down, for sure. Long talks, not giving up. You know what I mean? I know when I was going through the whole thing, back and forth with even me being able to be eligible to take my test. He was one of the first people I reached out to, and like, bro, I can't believe they did this, that, and third. But you didn't let me jump off the ledge. You walked me to the edge, but you didn't let me jump off the edge. So I appreciate
I
it.
walked with you to the edge. I didn't walk you to the edge.
Yeah. So yeah, man, just family, friends, man, and yeah, just celebrating success by gratitude, man. Just thinking, posting a lot of the posts that I post like on social media now has been a lot geared towards like just gratitude and just being grateful even when things aren't going your way, or even when you're having like a sucky day at work, and you just sit back and think like, man, I remember praying to have this day. I remember praying to be in this space, to put on this coat, or to put on this scrub cap, or to be able to go in here and talk to someone with the esteem that knowing that I'm the provider. I remember praying and pulling and working so hard for these days, even though they today has been very hard, and it's been a very tough day for me. I'm still going to remain gracious for it, because there are people who are literally begging and wishing to be in your position. So I'll never take it for granted, bro. So that's one of the things that I do to just kind of celebrate my success in that regard.
Got you. What about you, Mike?
Yeah, I would say, of course, family and friends supported me and mentored me throughout the process of where I'm at today. And I would say my medical director, when I first started off as a hospitalist, I had no experience. In nursing and NP school, you think you know everything, but then when you get a real patient, they have multiple things going on, so you really don't know where to start. But he always told me that he made sure that he said my success is his success and my failures are his failures. So he made sure that he equipped me with all the knowledge and education that I needed to, become a great hospitalist. And I would say how I celebrate. I would say every day is a day. Like Glorilla said it best. At the end of the day gonna end. So if you had a bad day tomorrow, you can reset and start over. So pretty much, and just doing things that I enjoy. That's how I kind of celebrate.
Yeah, no doubt. Awesome, man. Yeah. Same, man. Family, wifey holding it down while I'm out chasing this dream and chasing that dream, is an absolute support, man. And I feel extremely blessed, man, to have so many mentors in different areas, be it in the profession, outside the profession. I can't even name them all, but I've had people supporting and cheering and pushing me along the way. One of my good friends, he always tell me, if you keep pushing, I keep pulling. You know what I mean? And just having people like that in your corner, man, you feel unstoppable, man. Even when you run into those obstructions, you know you got a whole team of folk riding with you that's gonna help you overcome these barriers. So, and as far as celebrating it, man, bro, like you both said, counting gratitude, knowing that each day is gonna end, a new one's gonna begin, and just happy to keep doing what I'm doing, man. Happy to, I celebrate each successful encounter. That's part of my celebration, you know. So that's what I would say, man. And just enjoying life, man. Enjoying life as much as possible, traveling, spending time with friends, and that's how I celebrate it. So now let's look at, leveling up, giving back, doing things that extends beyond just the job. Is there any teaching or mentoring that you all are doing individually, and why is that so important?
So I would say I started this past year doing being a preceptor at the hospital that I'm working with. If sometimes people are hard, I guess it's harder now compared to when I went to the NP school to get a preceptor because the school found it for us. So now helping out people that look like me, getting that preceptorship and kind of encouraging them to that, it's going to be tough, it's going to be hard, but it's going to be worth it at the end of the day. So I think that's one thing. I'm a tough preceptor, I would say, because I was also a TA while I was in grad school, and the students did not like me while I was in grad school. But after the next semester, they called me and emailed me saying that I was the best thing that they had so far. So I just holding people accountable and shaping them up to be the best provider. Because especially if you look like us, you have to be twice as good to be considered as half as good as your next counterpart. So I just want to instill that work ethic in people. So that's what I enjoy doing.
Gotcha. G.
This upcoming June, after I hit my 1 year, I'll be starting with precepting students. So I'm super excited about that for some of the same reasons that Mike mentioned, just because it is hard for NP students to gain preceptors. It's definitely not as easy as it once was. And a lot of schools used to actually find the preceptors for you. So it seems like hardly any school does that now. But so I'm excited to be a resource in that regard. I am working with my chapter of Omega to continue with pushing the narrative in terms of Black men's mental health. I'm doing a lot of seminars in that regard to just talk about mental health awareness within the community in general. I'm also helping my wife, who's an oncology social worker. I'm speaking at some of her men's groups that she has, her support groups for patients who are dealing with oncology diagnosis, specifically the men, and talking to them about preserving their mental health while battling an oncology diagnosis. So, yeah, man, just doing those things just to kind of continue to keep my enthusiasm surrounding my profession. I think that's super important because it really does give you purpose outside of just clocking in and clocking out. The extra work on top of that, it just makes the work even more fulfilling. So yeah.
Sure, man. And as on my end, as far as the mentoring and teaching goes, back in January of '04, I had my first shadow come through as a CRNA. So yeah, I think that's very important because apparently there's difficulty for people to be able, kind of like Mike said, with people having difficulty um, finding preceptors. Folks are having difficulty getting into the OR and shadowing, which is a major requirement for folks to get into school. So that's one of the things that I do. And of course, always being willing to go back and talk to nursing students, paramedic students. It's just real important for all of that.